Imagine your brain shutting down in minutes. It's not a stroke or a heart attack, it's the hidden danger of hypoglycemia. Hypoglycemia occurs when blood glucose levels fall below the normal range, typically less than 70 milligrams per deciliter. Glucose is the primary and immediate energy source for the brain. Without it, cellular function begins to fail almost instantly. Unlike the liver or muscles, the brain cannot store glucose. It depends on a continuous supply from the bloodstream to survive. When glucose falls, the brain's metabolic rate drops, leading to a cascade of neurological and physiological disruptions. The body first triggers a neurogenic response, activating the autonomic nervous system to signal a crisis. In response, counterregulatory hormones like glucagon and epinephrine are released to try and raise blood sugar levels. Early symptoms like sweating, tremors, and a racing heart serve as a critical alarm system for the body. As levels drop further, the brain enters neuroglycopenia, a state of actual glucose starvation in the brain tissue. At this stage, patients experience profound confusion, blurred vision, and significant difficulty speaking. Without intervention, the impairment progresses to seizures and a total loss of consciousness as the brain shuts down. Prolonged hypoglycemia carries a severe risk of irreversible brain injury and permanent cognitive deficit. The timeline is unforgiving. Brain function can deteriorate significantly in as little as 30 minutes of severe deprivation. In diabetic patients, this is often caused by excess insulin, missed meals, or unexpected physical exertion. Those on insulin therapy are at the highest risk, requiring constant vigilance and frequent monitoring. Certain oral medications can also trigger prolonged and dangerous drops in blood sugar if not managed carefully. One of the most dangerous conditions is hypoglycemia unawareness, where the body stops giving early warning signals. Nocturnal hypoglycemia, low blood sugar during sleep, is a silent threat that can go completely unnoticed. Children and the elderly are particularly vulnerable, often lacking the ability to recognize or communicate symptoms. The sympathetic surge can stress the cardiovascular system, potentially leading to dangerous heart arrhythmias. Even mild hypoglycemia impairs cognition, memory, and the critical ability to make sound safety decisions. Severe hypoglycemia is a true medical emergency that requires immediate, life-saving intervention. The rule of 15: consume 15 grams of fast-acting carbohydrates and wait 15 minutes to recheck. If the patient is unconscious, glucagon must be administered immediately to trigger a rapid glucose release. In a hospital setting, intravenous dextrose is the standard of care to rapidly restore safe glucose levels. Recovery doesn't end with treatment. Careful monitoring is essential to prevent a secondary, rebound drop. Repeated episodes can lead to long-term cognitive decline and structural changes within the brain. Prevention focuses on consistent meal timing, careful dose adjustment, and proactive glucose monitoring. Modern tools like continuous glucose monitors provide real-time data to stop hypoglycemia before it starts. Patient education is the best defense. Recognizing early signs can prevent a mild drop from becoming fatal. Safety strategies are vital for high-risk activities like driving or intense physical work. Always check before you go. Pregnancy and chronic illnesses require even more specialized management strategies to maintain safety. Public awareness saves lives. Knowing how to help someone in a crisis can prevent permanent brain injury. Rapid recognition and action are the only ways to prevent hypoglycemia from stealing a patient's life or mind. Stay vigilant and stay informed. In our next video, we'll dive deeper into managing these emergencies at home. See you there.